Welcome back, everybody. We're doing a deep dive today into AI and healthcare. We found this article, Could AI Help Us Live Longer and Healthier Lives? And, well, it just got us thinking. It's got all these wild predictions about how AI is going to, revolutionize medicine. So we're going to try to break it all down.
Yeah, it's really not just about living longer. It's about living better, right? Like what we're seeing is this shift away from the one-size-fits-all approach to healthcare to something way more personalized. And AI is making that possible because it can, crunch these massive amounts of data.
Yeah, the article talks about, personalized medicine. So treatments that are, tailored to your genes, your lifestyle, and even, and this is where I need a little help, your microbiome. Microbiome, remind me what that is again.
Oh, yeah, the microbiome. So that's basically all the, trillions of bacteria that live in our gut. It's like a whole, think of it like a complex ecosystem in there. And it influences, so many things, from how you digest food to your immune system. And what's really cool is that research is showing all these links between certain gut bacteria and conditions like obesity, heart disease, even mental health.
Okay, so is AI going to be able to analyze my gut bacteria and then tell me what I should be eating?
Exactly. Imagine getting dietary recommendations that are based on not just how many calories you need, but the actual types of bacteria that are thriving. Thriving in your gut. And AI can even help us develop therapies that actually target the microbiome to improve your overall health. There's this company, Viome, they're already using AI to do this, to analyze that microbiome data. And they're providing personalized nutrition advice. They're even working on therapies for chronic diseases based on what they're finding out about the microbiome.
Wow. That's incredible. It's AI is giving us a whole new understanding of our own bodies. But the article also talks about AI in disease diagnosis. And this is where it gets really, really interesting.
Oh, absolutely. This is huge. One area where AI is already making a big impact is in radiology. So AI algorithms can actually analyze medical images like X-rays, CT scans, and they can spot these tiny abnormalities that even the best radiologists might miss. It's like having a second set of eyes. But these eyes, they never get tired, and they can process information so much faster.
Yeah, so we're talking about potentially catching diseases way earlier when they're
eager to treat. Exactly. There's this study where an AI was able to detect lung cancer nodules in these CT scans with 95% accuracy. It was actually outperforming the human radiologists. And with lung cancer, early detection is crucial, right? The survival rates are way higher when you catch it in the early stages.
That's incredible. It's like AI is giving doctors this, superpower to see things that they couldn't see before. But early detection isn't just about images, right? The article mentions smartwatches that can use AI to predict heart attacks before you even feel symptoms? Is that even possible?
Oh, it's definitely possible. Researchers are developing these algorithms that can analyze data from wearables, smartwatches, to pick up on those subtle changes in your heart rate, your sleep patterns, even your activity levels. That could point to an increased risk of a heart attack.
So it's like having a personal bodyguard for your heart, constantly monitoring for any signs of trouble. But what about developing new treatments? The article also mentions that AI could speed up drug discovery, which we all know takes years and a ton of money.
Oh, yeah, that's right. One of the biggest challenges with drug discovery is just identifying potential drug candidates from this massive library of chemical compounds. That process can take years and it involves so much trial and error. But AI is really changing the game here. Well, AI algorithms, they can analyze these huge data sets of chemical structures and biological data to predict which compounds are most likely to be effective against, a certain disease. So this can dramatically cut down the time it takes to develop a drug and the cost.
Okay, so instead of blindly testing thousands of compounds, scientists can use AI to zero in on the most promising ones.
Exactly. And we're already seeing real-world examples of this. There's this company called Atomwise. They used AI to identify potential drug candidates for Ebola in just one day. I mean, traditionally, that process could have taken months or even years. And during the COVID-19 pandemic, AI played a huge role in speeding up the development of vaccines and treatments.
Wow, that's incredible. It seems like AI is really living up to its hype when it comes to healthcare. But okay, I have a question. What about preventing diseases in the first place? Can AI help us stay healthy rather than just treating us when we're already sick?
Oh, absolutely. That's a key focus in AI healthcare. Imagine a world where AI analyzes your genetic data, your lifestyle, even your environmental factors to create a personalized risk profile for you.
So, like, if I'm at risk for diabetes, AI could, like, suggest certain changes I could make to lower my risk.
Precisely. And it goes beyond just suggesting changes. You can actually personalize those suggestions based on your preferences and your habits.
Mhm.
Like, say you're someone who loves to cook, AI might suggest recipes that are both healthy and tailored to, the
Yeah.
kinds of foods you enjoy. Or if you're like
Yeah.
an outdoorsy person, AI might recommend activities that'll help you stay active and
Oh,
engaged.
that's really interesting. It's like having a personal health coach who, like, knows you inside and out. But I'm also wondering about, like, the mental health aspect. Can AI play a role in supporting mental well-being?
Oh, absolutely. I mean, mental health is just as important as physical health, right? And AI is starting to make some real inroads in this area, too.
How is that happening?
Well, for one, AI-powered apps and chatbots, they can provide on-demand support. For people who are struggling with anxiety or depression, these tools can offer coping mechanisms, connect users with resources, and they can even track mood changes to try to identify potential triggers.
That's really helpful, especially for people who, might not have access to therapy or who just, prefer the anonymity of talking to a chatbot. But what about, like, more serious mental health conditions? Can AI play a role in diagnosing and treating those as well?
Yeah, that's definitely an area of active research. Scientists are developing AI algorithms that can analyze things like speech patterns, facial expressions,
Yeah.
even social media activity to detect early signs of mental health conditions like schizophrenia or bipolar disorder. The goal is to be able to,
Yes.
identify individuals who might be at risk and intervene early before these conditions become more severe.
Yeah, that's fascinating. It seems like AI has the potential to touch, like, every aspect of healthcare, from personalized medicine to disease prevention to mental health support.
Yeah, it really does. It's a super exciting time to be working in this field. It feels like the possibilities are just endless. But of course, like with any new technology, there are challenges, and we have to think about, the implications. We need to make sure that AI is used responsibly and ethically, and that its benefits are available to everyone.
That's a really important point. But before we dive into those considerations, I want to touch on one more aspect of AI's potential: aging. We're living longer than ever before. But how can AI help us age gracefully and maintain our independence as we get older?
That's a great question, and it's one that researchers are actively exploring, like AI-powered robots and
Yeah.
smart home systems. They could assist seniors with daily tasks, like medication reminders, or helping them get around. And AI algorithms could analyze data from wearables and sensors to detect those early signs of health decline, which would allow for, timely interventions.
So it's not just about extending lifespan, but about, like, improving the quality of life in those later years.
Exactly. And it goes beyond just assistance, too. AI could potentially analyze aging biomarkers and develop interventions to slow down aging itself.
Wait, are we talking about cracking the code of longevity? Like, actually slowing down aging?
That's a frontier of research. But the possibilities are incredible. AI could analyze cellular data, look for those signs of aging, and maybe even develop treatments to extend lifespan and health span.
This is mind-blowing. It seems like AI is going to revolutionize healthcare in ways we can barely even imagine. But as you mentioned earlier, it's important to think about the potential challenges and the ethical implications of this technology. So we'll dive into those in the next part of our deep dive. But for now, I want to thank you for sharing your expertise. This has been incredibly enlightening.
Oh, it's been my pleasure. I'm always happy to talk about AI and how it can make healthcare better for everyone.
Okay, so we've covered a lot of ground here, from, like, personalized diets based on our gut bacteria to AI predicting heart attacks before they even happen. I mean, it's clear that AI has just incredible potential to improve our health. But I think it's time to address, kind of, the elephant in the room, the potential downsides.
Yeah, absolutely. Like any powerful tool, AI needs to be developed and implemented responsibly. And that means thinking about some important considerations.
Like, for example, the sheer amount of data that AI relies on. We're talking about our medical records or genetic information, even data from our wearables, like our smartwatches. That's a lot of very personal information.
Right. Data privacy is paramount. We need to have really strong safeguards in place to make sure that this sensitive information is protected from misuse or breaches. And it's not just about keeping the data secure, it's about who has access to it and how it's used.
Yeah, that makes sense. You wouldn't want your health data falling into the wrong hands.
Right.
Or being used for something that you never agreed to.
Exactly. There's also the issue of algorithmic bias. AI algorithms are trained on data. And if that data reflects existing biases in healthcare, those biases can get amplified by the algorithm.
So, like, for example, If an algorithm is trained on data that mainly comes from a certain demographic, but might not be as accurate or effective for people from other demographics.
Exactly. We need to make sure that AI algorithms are trained on diverse data sets and that they're carefully tested to minimize bias and ensure fairness for all patients.
Okay, so that sounds like a pretty big challenge. How can we be sure that AI is being developed with these ethical considerations in mind?
Well, it takes a multi-pronged approach, right? We need clear regulations and guidelines for how AI is developed and used in healthcare. We need the researchers and developers to prioritize fairness and transparency in their work. And we need an informed public that understands the potential benefits and risks of AI and can hold developers accountable.
So it's a team effort. It's not just about the technology itself, it's about how we choose to use it. We need to make sure that it benefits everyone, not just the select few.
Absolutely. And that brings up another really important consideration: access and affordability. AI-powered healthcare has the potential to be incredibly beneficial, but we have to make sure that those benefits are available to all, regardless of their socioeconomic status or where they live.
Right. We wouldn't want to create a healthcare system where only the wealthy can afford the best AI-driven treatments and diagnoses.
Exactly. We need to think about equitable distribution and access so that everyone can benefit from these advancements. And that might involve government subsidies, insurance coverage, or even like creative partnerships to make AI-powered healthcare more affordable and accessible.
Yeah, it's like with any new technology, right? There's this initial period where it's expensive and only available to a small group. But then over time, as production scales up and costs come down, it becomes more widely available. Hopefully we'll see a similar trajectory with AI in healthcare.
I'm optimistic that we will. There's a growing recognition of the importance of equitable access. And I think we're going to see more and more initiatives that are focused on making AI-powered healthcare affordable and accessible to all.
That's good to hear. Now, I know some people are concerned about AI replacing human doctors and nurses. What are your thoughts on that?
Yeah, I understand why people might worry about that, but I really see AI as more of a collaborative tool than a replacement. AI can handle those repetitive tasks. It can analyze data quickly and provide insights, but it can't replicate the empathy, the critical thinking, and the human connection that are so crucial to patient care.
So it's not about AI versus humans. It's about AI and humans working together to provide better care.
Exactly. Imagine a world where doctors and nurses are freed from all those tedious administrative tasks and data analysis, so they have more time to spend with their patients, providing personalized care and building those crucial human connections. AI can empower healthcare professionals to focus on what they do best: healing and caring.
That makes a lot of sense. It's about leveraging the strengths of both AI and human expertise to create a healthcare system that is both efficient and compassionate.
Precisely. And I think we're already seeing that happening in some areas. For example, there are AI-powered tools that can help doctors diagnose skin cancer more accurately. But it's still the doctor who makes the final diagnosis and decides on the best course of treatment.
So AI is like a support system, providing valuable information and insights, but ultimately the human doctor is still in control.
Yes, and I think that collaborative model is going to become increasingly common as AI continues to evolve and becomes more integrated into healthcare. It's about finding the right balance between human expertise and AI's analytical power.
That's reassuring to hear. So we're not talking about a future where robots are running the hospitals, but rather a future where AI assists and enhances the work of human healthcare professionals.
Exactly. And that brings us back to the importance of education and training. We need to make sure that healthcare professionals are equipped with the knowledge and skills to effectively use these AI tools and interpret their outputs.
So it's not just about developing the technology, it's also about preparing the workforce to use it responsibly and effectively.
Exactly. It's about embracing the potential of AI, but also recognizing its limitations and making sure that human judgment remains at the forefront of healthcare decision-making.
This conversation has really been helpful in understanding the complexities of AI in healthcare. It's not just about the technology, it's about the ethical considerations, the human element, and the need for careful planning and implementation.
Yeah, you've really hit the nail on the head there. AI in healthcare isn't a simple solution. It requires careful thought, open dialogue, and a commitment to making sure that these advancements benefit all of humanity.
I think you're absolutely right. We've explored the potential benefits and the challenges. We've talked about the ethical considerations, and we've discussed the importance of human-AI collaboration. But there's one more piece of this puzzle that I want to explore.
Okay, what's that?
The impact of AI on our understanding of aging and longevity. We touched on this a little bit earlier, but I'd love to dive a little deeper into the research and what it could mean for the future of human lifespan.
Yeah, that's a fascinating area. And it's moving really quickly. Researchers are using AI to analyze these massive data sets of genetic and biological information to try to identify the factors that contribute to aging and longevity.
So we're talking about using AI to crack the code of aging, to figure out what makes some people live longer and healthier lives than others.
Exactly. And the insights from this research could lead to new interventions that could slow down aging, prevent age-related diseases, and extend human lifespan.
Wow, that sounds almost like science fiction. Are we really talking about a future where people could live to be 150 or even 200 years old?
It's definitely a possibility. We're still in the early stages, of course, but the potential is huge. AI could help us pinpoint the key pathways that are involved in aging and then develop targeted therapies to delay or even reverse the aging process.
That's mind-blowing, but it also raises a whole bunch of ethical and societal questions, like what would a world with significantly extended lifespans even look like? How would it impact our social structures, our economies, our planet?
All great questions, and those are definitely things that we need to start thinking about now. The potential for increased longevity is exciting, but it also comes with big challenges that we need to be prepared to address.
It's clear that AI isn't just transforming healthcare. It's making us rethink what it means to be human and what the future holds for our species. We've covered a lot of ground in this deep dive, and I think it's time to kind of shift gears and wrap things up.
Yeah, I agree. It's been a really fascinating conversation, and I hope our listeners have learned something new today about the potential and the complexities of AI in healthcare.
Wow, so we've talked about everything from like analyzing our gut bacteria to AI potentially helping us live way longer and healthier lives. It feels like we've barely even scratched the surface here.
Yeah, we really have. I mean, this field is just exploding. There are new discoveries and advancements practically every day.
It is incredible to think about all the possibilities, but I also keep thinking about something you said earlier about the need for, like, thoughtful implementation. How do we make sure that this technology is actually used responsibly and that it benefits everyone?
Yeah, that's the big question, isn't it? And honestly, there's no easy answer. It's going to take, a multifaceted approach. We need the researchers. We need policymakers, healthcare providers, and the public all working together.
So it's not just about, like, the
perfect family.
scientists in the lab, right? It's about creating a broader conversation.
Exactly. We need to be having these open and transparent discussions about the ethical implications, the potential risks and benefits, and how we as a society want this technology to shape the future of healthcare.
I think one of the things that makes this so tricky is that AI is evolving so quickly. It feels like every week there's some new breakthrough or discovery. How do we keep up with that pace of change and make sure that, our ethical frameworks and regulations are keeping pace too?
Yeah, that's a huge challenge. And it's going to require this ongoing dialogue and collaboration between experts in all different fields. So we need ethicists, legal scholars, social scientists, and of course, technologists, all working together to develop adaptable frameworks that can actually guide the responsible development and use of AI in this context.
So it's not about, setting these hard and fast rules today that might be totally obsolete tomorrow. It's more about, creating a more dynamic approach to governance.
Exactly. We have to be nimble, right? We have to be adaptable. We need to constantly be evaluating the emerging capabilities of AI and then adjusting our ethical frameworks and our regulations accordingly.
That's a tall order, but it's essential, right? We're talking about technology that could fundamentally change what it means to be human, to be healthy, to age. We can't just let it all unfold without really carefully considering the potential consequences.
And that's where the public comes in. We need informed citizens who understand the potential benefits and the risks of AI, who can participate in these discussions and who can, hold those in power accountable for making sure that this technology is being used responsibly.
So it's about empowering people to be active participants in shaping the future of AI in healthcare, not just passive recipients of whatever comes out of the lab.
Absolutely. This is technology that's going to affect all of us. So we all have a responsibility to be sure that it's used ethically and equitably.
This has been a really eye-opening deep dive. We started by talking about the potential of AI to personalize medicine, diagnose diseases earlier, develop new treatments, and even help us live longer, healthier lives. But we also uncovered some, critical challenges and considerations that we need to address to ensure that AI really does benefit everyone and doesn't, make existing inequalities worse.
I agree. It's been a great conversation, and I really want to emphasize that while there are some big challenges here, I am optimistic about the future. There are so many brilliant people working on these issues, and with careful planning and collaboration, I really do believe we can harness this power of AI to create a healthier and more equitable world.
I share your optimism. It's really exciting to think about the future of healthcare and how AI is going to play a role. But as we wrap up today, I want to leave our listeners with one final thought.
Okay, what's that?
We've talked a lot about AI changing healthcare. But at the end of the day, the future isn't set in stone, right? It's up to all of us, as individuals and as a society, to decide how this technology is developed, how it's implemented, and how it's integrated into our lives. We have a responsibility to make sure that it's used ethically, equitably, for the betterment of humanity.
So well said. The future isn't something that just happens to us. It's something we create together.
And on that note, we'll wrap up this episode of The Deep Dive.
Thanks for joining us on this exploration of AI in healthcare. We hope you learned something new today and that you're leaving with, maybe, more questions than answers. Because in the world of AI, the questions are just as important as the answers.
Keep asking those questions, keep exploring, and keep engaging in the conversation. The future of healthcare really depends on it.
Until next time, stay curious.